Good morning, everyone. This is a session HIFU Rejuvenation for Face and Neck in collaborate with the Association of Korean Dermatologists. I'm Changgeun Oh from Korea, and my co-chair with the Shabra.
I'm Dr. Chiranjeev Shabra from New Delhi, India. I'm a practicing dermatologist, and I'm very happy to be here with you.
I'm sorry, it's really difficult to pronounce the foreign name, sorry. So our first speaker is Won-Gyu Hong from Korea. He will talk about skin quality improvement using a HIFU. Please.
Thank you. I'm Dr. Hong. It's truly an honor to speak this event. Today, I'll be sharing insight on enhancing skin quality using high-intensity focus ultrasound. What is skin quality? Good skin quality is defined as skin that look healthy, is full, free from damage. It typically assessed based on 4 key factors: skin firmness, skin surface evenness, skin tone evenness, and skin glow. What does skin quality decline? Both intrinsic and extrinsic aging are the primary contributor to skin quality deterioration. This aging process impacts all layers of the skin, but in my opinion, the epidermis and dermis play the critical roles in determining visible skin quality. So to improve these layers, we have been using many different energy-based devices and injections. For example, we can use lasers and radiofrequency to improve skin quality. However, I personally prefer to use HIFU not just for lifting, but also to manage the overall skin quality. HIFU treat has shown ability to reduce senescent fibroblasts and activate quiescent fibroblasts in the dermis. The dermis plays a most crucial role in skin quality as it actively communicates with epidermis. Using a 1.5 mm HIFU transducer allows use to focus energy precisely on the dermis, promoting regeneration of dermis, improving overall skin quality. Using 1.5 mm HIFU transducer offers a safe and effective approach to improving skin quality. It is suitable for all skin types and can be easily combined with various other treatments. While lasers may sometimes damage epidermis, leading to post-inflammatory hyperpigmentation or increased sensitivity, HIFU safely bypass the epidermis, precisely target the dermal layer, minimizing such risk. HIFU is commonly recognized for improving these 3 key aspects of skin quality: firmness, glow, and skin surface evenness. However, I believe HIFU can also indirectly enhance skin tone evenness. Therefore, in my opinion, HIFU contributes to improving all 4 factors of skin quality. For example, 1.5 mm HIFU treatment has been reported to improve UV-induced hyperpigmentation. There are also clinical reports demonstrating its effectiveness in treating melasma in Asian patients. Aging-related pigmentation such as melasma is accompanied by structural changes in dermis. I believe HIFU can help improve these underlying dermal conditions associated with aging, thereby indirectly improving pigmentation and overall skin tone. This study describes a method for treating enlarged pores in Korean patients using 1.5 mm HIFU transducer. Enlarged pores are one of the most skin quality concerns among Koreans. In this protocol, the middle face was treated with approximately 200 lines of 1.5 mm HIFU, specifically targeting to dermis, improve pore appearance. As shown in the photos, most patients achieved noticeable improvement. The treatment was especially effective for pores caused by a loss of skin elasticity rather than those related to excessive sebum production. Since optimal results were typically observed around 3 months after the procedure, they also recommend follow-up treatments every 4 to 6 months. I would like to share results from a small pilot study I conducted with 6 patients. The goal was to evaluate whether different energy levels would affect the treatment outcome for pores. This was a split phase study. The right side of each patient face was treated with 0.18 joule, the same energy used in previously mentioned study. The left side received a slightly higher energy of 0.20 joule. Both sides showed similar improvement in pore appearance compared to baseline, with no significant difference between two. Based on this result, I conclude that a moderate energy setting is sufficient for effectively treating enlarged pores. As shown in this photo, the side treated with higher energy level exhibit more swelling, and the patient also reported increased discomfort on the side. Since the final treatment outcomes were similar for both energy levels, this finding highlights the importance of using moderate energy setting in HYPE treatment to balance efficacy and patient comfort. While HYPE treatment alone is quite effective for improving overall skin quality, it can also be combined with other modalities depending on the patient's specific condition. In our previous studies, we observed that HYPE can be less effective in patients with high sebum production. To address this, we investigate a combined approach using HYPE and botulinum toxin. The results showed this combination was both effective and safe for reducing facial pores. As you know, toxin can suppress sebum secretion, making it particularly beneficial for patients with enlarged pores due to excessive oil production. This study demonstrates that combining 1.5 ml single-dose HYPE transducer with bipolar radiofrequency resulted in greater improvement across multiple skin quality factors, including pore size, dermal density, and periorbital wrinkles compared to using HYPE alone. To treat fine lines around the eyes, we can use slim tip version of 1.5 ml HYPE transducer, delivering approximately 150 lines on the periorbital area with this tip, typically resulting in noticeable improvement in periorbital fine line. This is my standard protocol using 1.5 ml HYPE transducer. We typically use a total of 580 lines to treat entire face with 1.5 ml transducer. When performing HYPE for lifting purpose, I always include the 1.5 ml transducer to enhance skin quality, if the patient budget allows. The effect of 1.5 ml HYPE treatment can be further enhanced by combining other modality based on the patient's specific concern. For patients with excessive sebum production, I typically add intradermal toxin to cheek to help regulate oil secretion. For those pigmentation issues such as melasma, I prefer combination approach using the single-dose 1.5 ml HYPE transducer together with bipolar RF along with monthly laser toning sessions. Let's take a look at a few clinical cases to see how these treatment strategies works in practice. This patient was treated with 200 lines using 1.5 ml HYPE transducer to improve overall skin quality. As shown in this photo, there is a clear improvement pore size, facial redness, and overall skin tone. This patient visited our clinic with recurrent melasma despite having undergone multiple laser toning treatment. She was then treated with a combination therapy consisting of monthly laser toning session and 1.5 ml single-dose HYPE transducer with bipolar radiofrequency function. Following this regimen, her melasma improved significantly. The result has been well maintained. This patient initially received the HYPE treatment primarily for lifting purpose. During the same session, we also applied 300 lines using 1.5 ml HYPE transducer to specifically target skin quality improvement. As shown in the result, in addition to lifting effect, there was a noticeable enhancement in several skin quality. In my experience, adding a high number of 1.5 ml HYPE transducer lines to the standard 3.0 and 4.5 transducer protocol not only improves skin quality but also enhances overall lifting effect. As will be seen in the clinical case, the 1.5 HYPE transducer effectively improves multiple aspects of skin quality and can be safely combined with other treatment modalities. In addition, incorporating 1.5 ml transducer into lifting protocols can further enhance overall lifting effect. Thank you for your attention.
let me invite, so I like to invite Dr. Ganju, a very respected and experienced dermatologist from India. Thank you very much.
Thank you, Dr. Chiranjeev, for those kind words, and thank you, IMCAS, for giving me this opportunity to be here amongst you. Thank you, Chairperson. So I'm going to talk about the evolution of the high-intensity focused ultrasound. Dr. Hong has already talked about. It's a very useful entity, but there are some shortcomings, like pain is a big problem, you know. Many of the patients do not come back for the procedure saying that it's very painful if you have to give effective, energies. And then there's a huge cost also involved in the cartridges. So I bring to you this new in-motion, HIFU, which has overcome these two problems to a large extent. So this non-invasive body contouring is a rapidly growing field in cosmetology, and many of the patients do not want to undergo needles, the scalpel surgery, etc. Although you can't give them as good a result as a surgical, lift, etc. But you can give them a fairly good improvement, and then the textural improvement and improvement in the skin quality, as Dr. Hong was talking, is something that we can give with these devices only, not with surgical. So these are the various non-invasive techniques available for subcutaneous fat killing and also for tightening of the skin, like the low-level laser light, the cryolipolysis, radiofrequency, and high-intensity focused ultrasound. Now, the high-intensity focused ultrasound has the advantage of going to a depth of, about 4.5, where it hits the SMAS, or the superficial aponeurotic, muscular aponeurotic system, which is responsible for holding the skin tissues together. So if you tighten this or pull this SMAS layer up, you're going to lift the skin. So this is the only device, non-invasive device, that helps you lift the skin by targeting the SMAS. So it increases the tissue temperature to the limit of protein denaturation, resulting in coagulative necrosis. There is alternating compression and expansion of the sound waves. It's basically ultrasound, due to which there is rupture of the adipocytes, so it kills the fat also. And in addition, it has been known to cause activation of various pro-inflammatory mechanisms leading to death of the fat cells. So as we age, all these factors are affected. The fibroblasts go senescent. They do not produce enough collagen. There is decreased collagen synthesis. The function of the skin appendages goes down. The gravity pulls down the skin, and there is sagging of the skin. So in order to address the aging skin, we need to address all these layers, and particularly this mass layer, which is the one that holds the skin, above and below. And if we lift it and tighten it, we are going to give a good lift to the skin. So ultrasound basically is just a device which produces sound waves and acoustic energy. It has two varieties, the high frequency and the low frequency, and the low frequency devices have the ability to penetrate deep into the skin. So we use all types. As Dr. Hong was talking, 1.5 is a high frequency device. It does not penetrate deep. A 4.5 depth is produced by a very low frequency and can go down and target the SMAS layer. So this SMAS layer is a very huge concept in HIFU. So what puts HIFU apart from other technologies is the ability of reaching the SMAS layer. No other technology, none of your lasers, no radio frequency is able to specifically go and hit the SMAS layer like the HIFU. So, and you can see immediate tightening. I'll show you some of the results, immediate tightening, but ultimately the final effect comes within 2-3 months. So you have to counsel your patients about the outcome and how it is going to evolve. So final results is got within 2 to 3 months. These are the common side effects, and my major side effect is pain. Many of my patients will not tolerate the required energy. So I would want to give a 1 joule, and a good density of the spots, but my patients won't tolerate it. So I have to compensate on the energy many a time, and therefore the result may be affected. So these are the conventional HIFU machines. We used to have these multiple cartridges, as Dr. Hong was talking about. We have a 1.5 mm cartridge, we have a 3.0, we have a 4.5, we have the longer ones for the body. And each cartridge shoots a multiple number of spots at the same time. So what that means is that these patients, one, there's a cost involved. So cartridges have a limited life, they have to be bought again, they're quite expensive. And when you are giving multiple shots at the same time, that is one factor that adds to the pain. And that's what I've seen when I have moved on to this new in-motion HIFU